This is very important part when I am discussing digestive system. Something goes to my mind saying that there is a beautiful explanation for kriyas. When you are doing kriyas, what are all those kriyas you do it in yoga? Vamana Dhauti, Laghu Shanka Prakshalana, Purna Shanka Prakshalana, Vastra Dhauti, all these practices, Strataka, Kapalabhati, all these 5 cleansing techniques. In that, Vamana Dhauti and Laghu Shanka Prakshalana are very interesting, and they involve the digestive system. So, upper part of the digestive system we call it as stomach, and above we call it as upper GI, small intestine and below we call it as lower GI. So, Vamana Dhauti, Vamana means vomiting, Dhauti means cleansing. So, there is a process where you take a lukewarm water and you add a required amount of salt as per preparation, that we do not discuss at this juncture, but when we are discussing about kriyas we will discuss that the isotonic nature of that salt is similar to the inside of our body. So, isotonic nature inside of our body, how much the salt content it is, that much should be the salt content of that particular water. So, what it means is you take a significant amount of water and add salt and just check the taste of the salt, which should be apt to equal, it should be equal to your body's salt content, something like that. So, it comes with a practice and it comes with a training. What the process where we take the lukewarm water added with isotonic or saline salt we add, and we will make them drink 5 to 6 glasses of water simultaneously, one after another, and then make the person bend down and put 2 fingers inside the oral cavity to touch the soft palate. We call it as a gag reflex. When we have that feeling, we call it as a gag reflex. You touch the soft palate and you induce vomiting. The stomach content is a huge amount of salt water inside your stomach, which is little lukewarm water, and when you do the gag reflex, you vomit the content out. We call it as Vamana Dhauti. What happens is the gastric mucosa will get stretched because of lukewarm water. It will send signal because of the irritation caused by the salt, and when you add the gag reflex, these 3 reflexes, stretch reflex of stomach, irritation of stomach because of the water, lukewarm water and the salt, and then you induce that gag reflex, these 3 induces signal to, these 3 send signal to the brain saying that something is not okay, please throw out the content. So, there is a reverse peristalsis. So, the stomach contents will normally it should go down towards the small intestine. So, it is going outside. So, it will search for nearest exit. So, that is, if stomach is a problem, you will feel like nausea, you feel like vomiting. So, you will vomit the content out. So, what happens after you vomit the content out? Once you vomit the content out, the gastric mucosa will be exposed for the hydrochloric acid, because it is diluted with water, it will be thrown out, and during that time you give a khichdi or the ghee based rice porridge, wherein you do not add more salt, you do not add more spices, you will not irritate the stomach mucosa. So, by doing this, the thickness of the covering layer of mucosal layer of stomach will become thickened because of the stimulation what you have given, you have made it thrown out. So, body will replace it, and that time of replacement you are giving khichdi, it will replace the digestive juice and it will replace the mucosal surface where it will not digest its own stomach, it will not cause any acidity, it will not cause any ulcerations of stomach, but in fact it will cure possible ulcers of the stomach because of thick mucosal membrane. So, this is in-depth analysis of knowledge of your anatomy, physiology in terms of digestive system and the knowledge of Vamana Dhauti. So, similarly, Laghu Shanka Prakshalana. Laghu Shanka Prakshalana means, Laghu means small, Shanka means the cut surface of the conch or a seashell looks like a intestines, Shanka. Prakshalana means spraying it out, Prakshalana is spraying it out. So, in the Vamana Dhauti you consume 5 to 6 glasses of water and you vomit it, but in this Laghu Shanka Prakshalana you consume 1 glass of lukewarm water, you exercise certain exercises pertaining to the abdomen, bending forward or twisting, turning, some of the exercise pattern we have, and you practice it. Again you consume water, you practice, you consume water, practice, you keep doing this. What happens? The water goes from the esophagus to the stomach, from the stomach because of the movement, gastric emptying time, it will be relieved out from the stomach to the intestine, maybe in the time of 20 to 30 minutes or less than that. If you are inducing an exercise, it will be less than that, and that water will go and clean the small intestine and the large intestine, and you go to the toilet and then you spray it out. So, what you mean? You defecate. Again you come back from the toilet, again you consume water, again you do exercise and defecate. So, this is a cleansing process by yoga, where you are cleansing the small intestine and large intestine. This is also similar, where the water will be used to cleanse the small intestine and large intestine. In this case, you do not consume immediate large quantity of water, because it will not stimulate the small intestine directly, it will stimulate the gastric mucosa. So, you consume little by little and then do exercise, so that you work on the small intestine and then large intestine. So, this is about Laghu Shanka Prakshalana. In yoga and Ayurveda, is both technique we use something called as Basti. Basti is cleansing the external orifice, that is anus and rectum area. So, there are multiple processes of Basti, there are multiple processes of utilization of Basti, which we will study in some time later in the depth of classes. In the next level 2 maybe it will be useful for you. Thank you. Just